Many times folks will take for granted that sense of hearing because it always happens until it doesn't. And that's where the folks at Coastal Hearing Center come into play. Karen Slater, thanks for joining me today.
Thank you.
Absolutely. Tell me what you do here.
So I am an audiologist. I have a practice here. We've been in this building for about 3 years. I have 6 providers, and we do a full range of comprehensive diagnostic audiology.
Who is your standard patient? Do you see all ages?
From newborns all the way through. We are the only facility that tests the newborn hearing screening when they fail at the hospital. They come to our office and we can do some brainstem testing and ASSR testing. We'll talk about that in a minute.
I have a 2-year-old, so I imagine like when you hear that your child didn't pass that test, so it's probably becomes a stressful, nerve-wracking moment. I imagine you guys have a room that's kind of set up for babies and moms and parents.
I'll be happy to show you.
It makes them, it kind of lets on their guard.
Yeah,
So that
rocking chair, little like home.
And of course, all the way up to those folks that are a little bit older that may need hearing aids. You're kind of set up for everybody here.
I am.
So we should go take a look at it.
All right.
Awesome. So once that newborn does, unfortunately fail that test at the hospital, Amanda Galot's the one that they're going to come and talk to here. Now, you do a lot of things here, but we're talking now about the newborn testing. Tell us about that.
So when a baby does not pass their hearing test at the hospital, they get referred to us, and we do some testing where they obviously don't have to respond, but we can do what we call an auditory steady state response test, an ASSR. We present 4 different frequencies at the same time, and we can get a better idea of the whole auditory system, how they are hearing. We can get an estimated response on their thresholds with that test.
And then, but these tests you can also apply to adults. It isn't just specific to children and newborns.
We can do these tests on adults. Anybody that we might be questioning the validity of their responses on a traditional hearing test, we can do these same tests and get a good idea of their thresholds with this objective test.
So the objective test you do out here is subjective test you do in this space over here?
Exactly.
So what's over here?
That is one of our auditory booths that we do traditional hearing tests in.
And again, would you use this? You wouldn't use this on a newborn, but maybe an older child?
Correct.
So everyone's here. I love that you have the rocking chair here. It kind of like helps families let down their
Yeah,
guard.
rock the baby. We want the baby to be asleep for that test. So the more comfortable they are, the better results we get.
That's awesome. Thank you so much. Well, we just spoke to Dr. Galot about kind of the newborn testing and the 2 types of testing they offer in that space. Dr. Sydney Lee is going to tell us about the audio booth here. Now, if you notice maybe this week or this month, or maybe it's different from last year, your hearing feels a little different, you can give them a call. This is kind of where they're going to start. Thanks for joining us.
Absolutely.
So tell us what happens in the booth.
Yeah, so this is our sound booth. So this is where our patients will be coming in. First, I'll have you come in, take a seat here. We always start off by looking in the ears first, of course, looking for anything like wax, drainage, anything that could be preventing some of that sound from getting through. Next test that we're going to run on our patients, it's called a tympanogram. It's a pressure test. It's going to look at how that eardrum is moving. It lets us know, is there anything like that wax in the ear? Is there anything like fluid, ruptured eardrums? Anything like that we're going to look for first before we start that hearing test. From there, we can run almost like a hearing screener that the patients don't have to respond to. So it's called OAEs. With this test, it's looking at how the hair cells in the inner ear are responding to the sound. So that's great for some of our younger pediatric patients who that's going to give us really ear-specific information without them having to raise their hand for those beeps.
Gotcha.
From there, we're going to get started with the hearing test itself. We'll put some headphones over the ears, and that's when the patients are responding to those beeps. So we're testing low-pitch sounds all the way to high-pitch sounds, and then we also do some speech testing as well, looking at that word understanding.
So you're hearing a word, and you're asking them to repeat that word back.
Yeah, so we do 2 different speech tests on all of our patients. The first one, we're going down to the softest level that they can repeat those words back to us. For our second test that we do, we're going to present all of those words at a nice comfortable level for them and looking at that word understanding from there.
So this is also where I'm going to get in trouble because you can see that I use a Q-tip.
Yes, exactly.
So once we finish here, then say it is a issue with wax or the buildup. You guys can take care of that as well.
Absolutely. We do ear cleanings here. We offer irrigation to where we can clean out those ears before we start that hearing test.
Well, then I think the next step is to go take a look at that.
Absolutely.
Awesome. Thank you. Well, we just talked to Dr. Lee about the hearing test they offer there, and she was talking about how you can see the ear canal if it's clean. That's what you do here if it's not, right? Tell us about this.
That's correct. This is a new piece of equipment that we got just recently. It's called the irrigator. It uses water to irrigate the ear and clean out any blockage or cerumen impaction that we find when we do the otoscopy in the booth.
And look, Dr. Taylor does a lot of things here, right? We're talking about this for today, but what if, say that's not a challenge, what if you have issues with maybe dizziness or balance? Do you address that as well?
We do. We have testing called video nystagmography, VNG. So we put some goggles on patients and we take them through about an hour-long test, which looks at eye coordination movement as well as putting their body in different positions and other stimulation of the inner ear to determine if they have a peripheral issue or a central issue. So you'll hear doctors talking about vertigo. Vertigo is a type of dizziness, and we will help determine what the cause is. And then if it's a peripheral vertigo, the most common one is called BPPV. That can be treated with another maneuver called an Eppley maneuver, and we do all that here in this room.
And you're going to have somebody put on what looks like this, like VR stuff. I'm sure that's not what it is, but that's what I can relate it to now.
Correct.
And all the testing happens right here.
Correct, yes.
And so is it an easy test? Is it invasive? How does that?
So the first part is very easy. It's all visual coordination. They'll be looking at a light bar, following a light, and doing some different tasks that we walk them through. Then we put their body in different positions to try to trigger movement-provoked dizziness. And then the last part is a little bit more invasive. We use air to stimulate the inner ear, changing the temperature and actually provoking some dizziness so we can see if it is that peripheral or central issue.
There you go. Dr. Charlene Taylor, thank you so much.
Thank you.
Well, Dr. Slater, we have really seen most everything that you guys have to offer. So what's the next step for folks if they want to, if they realize they have a challenge that they want to speak to you about?
Well, if you give us a call, Julia, Teresa are here in the Biloxi office, and their phone number is 228-207-7102, and they'll set you up to the closest office for you.
That's right. You have a couple of locations. Is this a kind of a practice where if you have a challenge or you think you have an issue, you can just call directly, or do you need to be referred?
Most people are referred. You certainly can call directly to us. Insurance reasons, sometimes we need a referral for that.
And like you said, they mentioned any age for the patient, newborns all the way up to just about whatever age folks feel they have a challenge, give a call.
So the Biloxi office is the one where we do a lot of the specialized testing. All 4 offices do the comprehensive hearing test and hearing aids.
It's really good to know that you have such a broad array of services, because you can just about tackle anything that would come up that would be a challenge, even for folks like me that use their Q-tips too much.
Don't do that.
Awesome. Thank you so much, Dr.
Thank
Slater.
you.
It's been nice talking to you.